The Centers for Disease Control and Prevention CDC is the leading national public health institute of the United States. The CDC is a United States federal agency under the Department of Health and Human Services and is headquartered in Atlanta, Georgia. Its main goal is to protect public health and safety through the control and prevention of disease, injuries, and disability in the US and internationally. The CDC focuses national attention on developing and applying a disease control and prevention. It especially focuses its attention on infectious disease, foodborne pathogens, environmental health, occupational safety and health, health promotion, injury prevention, and educational activity designed to improve the health of United States citizens. The Center for Medicare and Medicaid Service CMS is a federal agency within the United States Health and Human Services that administer the Medicare program and works in partnership with the state governments to administer Medicaid and Children's Health Insurance Program and Health Insurance Portability Standard. In addition to these programs, CMS has other responsibility, including administrative simplification standard from the Health Insurance Portability Act, quality standard in long-term care facility through its survey and certification process, clinical laboratory quality standard under the Clinical Laboratory Improvement Amendments, and oversight of healthcare.gov. The Food and Drug Administration (FDA) is a federal agency of the United States Department of Health and Human Services. The FDA is responsible for protecting and promoting public health through the control and supervision of food safety, tobacco product, dietary supplements, prescription and over-the-counter pharmaceutical drugs, vaccines, biopharmaceutical, blood transfusion, medical devices, electromagnetic radiation emitting devices, cosmetics, animal food and feed, and veterinary products. The FDA is led by the Commissioner of Food and Drugs, appointed by the President with the advice and consent of the Senate. The Commissioner reports to the Secretary of Health and Human Services. The National Institute of Health (NIH) is primary agency of the United States government responsible for biomedical and public health research. It was founded in late 1870. Now it's part of United States Department of Health and Human Services. The NIH conducts its own scientific research through Intramural Research Program (IRP) and provide a major biomedical research funding to non-NIH research facilities through the Extramural Research Program. NIH comprise of 27 separate institute and centers of a different biomedical discipline and responsible for many scientific accomplishments, including the discovery of fluoride to prevent tooth decay, use of lithium to manage bipolar disorder, and creation of vaccine against hepatitis and hemophilic influenza (HIB) and human papillomavirus (HPV). The United States Department of Health and Human Services (HHS), also known as the Health Department, is a cabinet level department of US federal government with the goal of protecting health of all Americans and providing essential human services. Its motto is improving the health, safety and well-being of America. HHS is led by the Secretary of Health and Human Services, who is appointed by the President with the advice and consent of the Senate. HHS is a principal agency for other agencies such as CDC, FDA, NIH. State medical boards are the agencies that license medical doctor, investigate complaints, disciplines the physician who violated the Medical Practice Act, and refer physician for evaluation and rehabilitation when appropriate. The overriding mission of a medical board is to serve public by protecting it from incompetent, unprofessional and improperly trained physician. Medical board accomplish this by striving to ensure that only qualified physicians are licensed to practice medicine and those physicians provide their patient with high standard of care. North Carolina Medical Board mission is to protect people of North Carolina and the integrity of a medical profession through just and vigilant licensing regulation. The medical board is independent agency that regulates the practice of medicines and surgery on the behalf of the state government such as the state of North Carolina, and medical employees are not on the state payroll. As far as question goes, which agencies are overlapping on each other? So if you haven't noticed, most of the agencies falls under the health of human services such as NIH, FDA, CDC and CMS. When I look at closely, I feel like CDC and FDA are a certain level, they're overlapping. CDC is mostly like controlling things, but still they have overlapping on especially the vaccination sector of the work, where they are just trying to overlap on each other. That's what I would argue here. Thank you.